Minister, Your Excellency the Ambassador, ladies and gentlemen, I should also like to welcome you to the 21st Health World, entitled The Healthcare System in the Fourth Industrial Revolution in Greece. A big question which needs to be answered during these 2 days is just how ready is the Greek health system to receive and accept this industrial revolution? A strong and powerful economy requires and needs a strong, reliable and effective healthcare system. It needs flexible structures, appropriate skilled healthcare professionals whom we actually have within our system, and it will most definitely need new technology, innovative technology, which will give solutions for the citizens' health by saving up on resources. Unfortunately, we're at a time in which all healthcare systems the world over are at a very difficult position. Budgets are unable to meet the challenges of the times. So our own healthcare system that is being underfinanced over the past 10 years is certain to be bound for difficult times, hard time, choppy waters in 2023. Our position as medical technology and medical technology companies is that we will need to find those sweet spots that will allow us to save resources within the healthcare system which we are operating in for all these years. It's impossible to ask for money that will never come. So in my introductory remarks, I will focus on 3 things that need to be done, need to be performed, for us to have a more flexible and reliable system at hand. First of all, the time has come for Greek hospitals to own the digital transformation they deserve. Utilization of digital tools throughout the structures of the healthcare system, starting from the primary healthcare, which we've been discussing about for all these years, with reliable diagnostic methods, and moving on to clinical and interventional effectiveness is something that we actually need to do right now. Terms such as telemedicine, teleradiology, robotic surgery, self-diagnosis, virtual training, are things that in other countries are already reality. They're already happening. We need to introduce them into our system and thus save resources through the upgrade of this technology. For this to happen, the second point we need to focus on is the collaboration of public and private sector agencies. It is luckily, unfortunately, something that this government has started working on, but it is impossible for these technologies to be available in the private sector and for us to be incapable of having a collaboration which would allow us to bring this technology in the hospitals, the public hospitals of the country. Third point, equally important, is to introduce into the Greeks' culture prevention. Prevention for all diseases that are tormenting citizens the years over. Such an initiative has already been undertaken over the past 2 years. It's called Anassa Zois, Breath for Life. It is a collaboration between the Pulmonology Society, the Greek Health Ministry and various other stakeholders that focuses on the prevention of lung cancer. It started in 2021. In 2022, a charter was drafted that is signed by various stakeholders in order to enlarge prevention for lung cancer and make it accessible to all citizens. In 2023, we are planning on organizing various screening centers to allow tests for lung cancer. It is something that will expand to cover other diseases and other forms of cancer. We firmly believe that prevention is indeed the way to save resources within the healthcare system, to shield the health of our fellow citizens and enhance the national healthcare system without creating problems that would be irreparable. We as medical device companies who are investing in the field of health over the past 20 years will keep on helping this government as well, but also all stakeholders and agencies within the national healthcare system to allow citizens and patients to rise to the level we deserve here in Greece. I should like to thank you very much for your attention, and I would like to invite Nikos